The healthcare debate is one of the most polarized issues in Capitol Hill and among the citizens who are divided by the political, economic, and social concerns implicated with it.
I don't want that the country as a whole to sort of kind of be divided on this issue, and B, I think we have so many economic problems right now. I think we should just try to deal with those first before we take the next step and deal with a lot of the healthcare issues. Although the healthcare problem is related to, sort of our long-term economic issues. I honestly think that, our first priority is to deal with jobs and really jobs and some of the other economic issues.
The lack of progress in order to pass healthcare reform is affecting many like Alice, who is a self-employed mother struggling to make amends with her situation and cannot afford insurance.
Well, I'm not sure how it will help me. Right now I'm self-employed with no insurance. I went in the hospital emergency room recently and I have to call them about the bill so I can pay it out of my own pocket. My business can't support insurance at this point. And, I'm just waiting to see where everything will end up. I have a son in college. He doesn't have insurance either because we can't afford it.
Others feel that because the politicians are not being clear with their constituents, the confused citizens are no longer voicing their concerns, and therefore legislators are acting without really hearing the problem affecting the voters they represent.
I don't think enough information is being disseminated to the public for the public to make an intelligent decision about it. Essentially, you have rhetoric on both sides, so the average person doesn't really know what's going on. And if you're someone like myself who has health care, you don't really care to, research it on your own because it doesn't affect me.
Most Americans are covered and will keep their coverage regardless of their approval of it. But like Tashmani Kanjano, even those covered feel the healthcare gap indirectly through those near them.
My friend, for example, she works with me at it's a clothing store. Our store doesn't offer healthcare or anything like that, so she can't go to the doctor, and she has a lot of problems, and it's hard, and she can't afford to pay out of pocket.
Are there any solutions when there seems to be no compromise on reaching a middle ground? Jerry, a Brooklyn area man, calls for the need of unison, not for the sake of healthcare reform, but for the necessity of the country's future.
We need bipartisan, we actually do. We need both sides of the aisle to work together effectively, because one side of the aisle saying, well, it's gonna drain the budget and this and that. They haven't come up with a meaningful solution. So we really need to stop the bickering, come together with some real solutions, and like the president said, let this be a teachable moment.